Word Eyes brings you any educational knowledge or information around the globe, current or many years ago, that has historical or significant value. It is your eyes to the world. If you're new to this channel, I would appreciate greatly if you tap the subscribe button and the bell notification as well, and to share this blog so others may also see it. Thank you. COVID-19. When are we going to have our life back? Everyone appears to be asking now. Here is my take on this. Since COVID-19 has been wreaking havoc into the lives of the people around the globe and has claimed so far as of this date of about 4.7 million plus lives worldwide, with the United States having the biggest number of deaths of about 700,000 plus, India coming in second with 449,000 plus deaths. The big question now is, when will this pandemic end? Will it ever go away and stop claiming lives? The short answer is, pandemic always end. Although vaccines do not necessarily end pandemic, they do help a lot in preventing disease, in preventing more deaths. Thus ends pandemic in a way. When people get infected or vaccinated, the pandemic ends. The pathogen stops spreading. However, the virus don't go away completely, as experts say. It undergoes transition. It mutates into a much deadlier strain or into a less deadly version. And that's what happened to the Spanish flu in 1918, believed to be the deadliest pandemic virus that ever infected humankind. World War I was coming to a close when the devastating flu emerged and spread across the globe. It infected an estimated 500 million people, killed 50 million victims, with the US losing about 675 lives. Vaccine at that time had not been developed yet. By the middle of 1920, the Spanish flu virus faded and the threat of the pandemic in many places had subsided. Because it had infected so many people around the globe, it became harder for the virus to look for new susceptible hosts. With the virus having fewer people to infect, the threat subsided. Those who had been infected and survived developed antibodies. They developed immunity to the virus, which could be partially protective. For how long it remains to be seen. Of course, the health measures implemented by the government, like wearing of masks, washing of hands, isolating infected people, closing of schools and business establishments, contributed greatly to ending the pandemic. With the background immunity so widespread, the pandemic ended. Yes, viruses fade, but don't disappear completely. They mutate into another form, into seasonal flu that we every now and then are facing. In 1957, the Asian flu claimed 1.1 million deaths as the virus spread rapidly. Antibiotics, which were available then, were initially used to treat people with secondary infections, thus limited the spread of the virus and its mortality. By fall, vaccine was developed, rolled out worldwide, and subsequently vaccinated more than 30 million people that finally helped contain the pandemic. Likewise, the health measures implemented in 1918 were again put in place, like wearing of masks, washing of hands, quarantine, and closure of schools and business establishments when necessary. The pandemic of 1968 resulted in the death of about 1 million people worldwide. Vaccines became available, about 22 million doses, only after the pandemic had peaked in many countries when it had already killed large number of people. The partial immunity acquired from the 1957 pandemic had reinforced the immunity developed by the people who got infected and survived the 1968 pandemic. The vaccine at that time had been set aside. It happened again in 2009, the year of the swine flu. It killed about 300,000 people out of the 60.9 million people who got infected. When the vaccine was ready, countries canceled large portion of their orders because the pandemic was gone. Due to the large number of those who got infected and recovered, their immunity to the virus had greatly increased. Scientists said the virus didn't go away. People didn't develop herd immunity either. The virus just stopped spreading. It faded into the background. Now let's go back to the current pandemic of 2019 that produced the coronavirus or COVID-19. It has infected 237 million plus worldwide so far, registering 4 million plus deaths. The US having 45 million plus infected patients with about 30 million plus who recovered and 732,000 plus reported deaths. India came in second, nearing the 34 million plus cases and about 33 million plus infected patients who recovered, about 450,000 plus deaths reported. To date, at least 6.41 billion doses of vaccines have been administered globally. China leads the world in vaccination with about 2 billion plus doses, while India coming in second with 925 million plus doses. The US has 401 million doses administered so far. And for those who still couldn't make up their mind, a CDC expert says that the unvaccinated people are 5 times more likely to get infected and up to 11 times more likely to die. Containing the virus is essential in ending the pandemic. CDC said that the containment would include social distancing, improving hygienic practices, mask wearing, isolation, and only when necessary, closure of schools and business establishments would be imposed. CDC further emphasized that the success of such measures would always depend highly on how the population accepts such health and preventive measures, and that include the questions of getting vaccinated. As people build up immunity through infection and or vaccination, health scientists expect that the threat would be diminished. The threat would ease from a crisis to nuisance, something that is with us like the common cold or flu. The immunity acquired from vaccination will produce long-lasting protection against the coronavirus and ultimately brings end to the pandemic. That is why it is essential people get vaccinated. Vaccination will prevent also the emergence of new variant that causes new disease. On the same note, if the G20 would take the global leadership in making the vaccines available to the developing countries, the vaccination of a much greater number of about 75% of the world population, the chances of developing herd immunity worldwide would be that great. 6 months would be the earliest for the good news to arrive. When that happened, the peace of mind that has escaped the world for quite some time would be back again. And that would be the time the whole world could breathe a sigh of relief. And that's for now for World Eyes. Stay tuned on my next vlog. And don't forget to subscribe, please. Thank you.